We're now going to look at how to quickly assess an unwell child using BBB approach: behaviour, breathing and body colour. This simple tool helps you recognise a seriously ill child early, even before advanced monitoring or medical help arrives. It's based on the UK Resus Council and ERC 2025 Paediatric Assessment Guidelines. The first B stands for behaviour. Start by observing how the child is acting. Their behaviour gives some of the earliest and most important clues that something may be wrong. Ask yourself, are they alert, interactive, or responding normally for their age? Be concerned if the child is not fully conscious or difficult to wake, has become floppy or rigid, is having a seizure, seems confused, agitated or behaving abnormally, is crying inconsolably, can't move one of its limbs, and finally, if the child appears to be in severe pain or suddenly can't speak or walk when they could before. Abnormal behaviour often means the brain isn't getting enough oxygen, blood flow, or glucose, and urgent help is needed. The second B stands for breathing. Next, look and listen to how the child is breathing. Changes in breathing rate are common in serious illness or injury. Watch for signs such as being unable to take a deep breath, working hard to breathe, breathing fast, grunting, flaring the nostrils, or drawing in under the ribs, making extra noises like wheezing or stridors, breathing that's too fast or too slow or irregular, stopped breathing altogether, and finally adopting an unusual posture to help breathing, such as leaning forward or using accessory muscles. If any of these are present, treat this as an emergency. The child may be tiring or close to respiratory failure, so immediate assessment and support are essential. The third B stands for body colour. Assess circulation to the skin and the child's overall body colour. Look for blue or grey tinge to the lips, tongue or fingertips, known as cyanosis. Mottled, pale or ashen skin, which may suggest poor perfusion or shock. For children with darker skin tones, look at the lips, the gums or palms for abnormal colouring. Cool, pale or mottled skin may indicate poor oxygen delivery or circulation problems, both of which require urgent medical review. Think of behaviour, breathing and body colour as a triangle, each side linked to the other. Behaviour reflects brain function, breathing reflects oxygen delivery, and body colour reflects circulation. A problem in one area can quickly affect the others. If you notice abnormalities in two or more sides of the triangle, the child is likely to be seriously unwell and needs immediate medical help. The BBB assessment is a fast, reliable way to spot a sick child before the condition worsens. Remember, behaviour, breathing and body colour. If you're ever unsure, treat it as an emergency and get help straight away. Early recognition saves lives.